The last 6 years, I was training to be a dietitian, and my husband was diagnosed with cancer. And so I learnt a lot about nutrition and cancer through the course of taking care of him, and he is flourishing and doing very well, which is wonderful. But I work here on campus at the Cancer Centre with Dr. Camage, and I've worked here for 4 years now. And I deal with questions about nutrition and cancer all day long, and taste changes and nausea and how can I eat better? You know, what do I need to do? What is different from cancer nutrition to normal nutrition? We also have a cooking class here on campus, which is fairly unique. There are not many cancer cooking programs in the country. Ours is called Culinary Comforts, and we work a lot on foods that we want to emphasize during the course of either treatment or survivorship, spices that are of interest, whether it be turmeric or cumin, working on foods that are going to give you the calories if you are losing weight unintentionally, and the protein if you're working on something like that. So today we actually have 2 salads, and both of these recipes are actually included on your little flash drive. And the first one we are going to work on is an avocado, jicama and orange salad. And the second one is a watermelon, feta and black olive salad. And as you can see, Chris here is my trusty assistant, and he is very well dressed for the occasion. Dr. Camage referred to it as his loincloth. Because of its positioning. I think it's rather small. It's rather small. So we will be giving you samples of the food, and I usually try to do it as I'm cooking it, because what we have found is people get hungry watching food being prepared. I don't know about you, but if you're watching something on the Food Network, it can make you feel more hungry than you ordinarily are. So the reason why we're working on these salads is because we follow the American Institute of Cancer Research guidelines for healthy nutrition and physical activity, and they focus on a largely plant-based diet with lean proteins. And so really looking at trying to get as many fruits and vegetables into your diet as you possibly can, but then also looking at the other side of the spectrum is, am I going through treatment? Am I more tired than I normally am? Do I need recipes that are quick and easy? And I don't know anyone who doesn't need that, but how do I get more fruits and vegetables into my diet that I can do pretty much in half an hour? So when Carly gave me the brief that this was going to be a 30-minute from start to finish cooking demo slot, it's like, wow, this is a really fast turnaround. So, because cooking demos don't just happen. I know on television they make it look so easy and seamless, but anyone who tries to do what they do, it takes 3 times the time that it normally does. So we're going to start with the jicama salad, and this is a jicama for those of you who haven't seen a jicama. They're in season at the moment, as are the oranges and the avocados, so this is a great seasonal salad. The way to peel a jicama is, it's a very fibrous vegetable, so just sort of getting a piece of the peel at the top and just pulling it down is the way to peel that. And then just slicing it into matchsticks, which is what I've done here. And we have this salad that Chris is going to start handing out. So the jicama is high in fibre. Can really help if you are struggling with constipation, which can sometimes be a problem through treatment if you're on pain medications. And this salad, I really like it because it's got a lovely flavour to it. So often patients will report that their sense of taste is not great, that food just doesn't taste the way they expect, or it tastes too salty, or it tastes too sweet. This salad has avocado. Fats are very good for coating the mouth and helping to transmit flavours. One of the differences in cancer nutrition is we really focus a lot on healthy fats. So this recipe has avocado and olive oil in it, and the reason why we focus on that is because sometimes people lose weight unintentionally. And this is an easy way to get some calories with great taste. The other part about this recipe is it's got lovely citrus in it. So it's got a really nice flavour. Often patients will say to me that foods just don't taste very good until they have something that's a fruit or a vegetable, like a bowl of strawberries, or something that's got a really pronounced flavour, like some fresh herbs that have been sprinkled in something. And then you really get that flavour boost, and you're like, oh, I can actually taste that. So often patients will say the only thing that tastes good is something that I've got a lot of soy sauce on it. And it's like, well, there's your salty and a little bit acidic, but a really pronounced flavour profile is often really helpful for nutrition. So we have the jicama chopped in the bowl, and then we have orange juice, curry powder, cumin, which is a cancer-fighting spice, with a little bit of salt and a little bit of sugar in here. We're going to add in some vinegar. So we're really just making a dressing, and this salad really benefits from sitting for a bit of time to allow the flavours to infuse. And then going into here, we've just got some olive oil. I'm just going to add in a very thin stream so that it can meld a little bit. And then I'm going to whisk this just a tiny bit. And you know, if you're making a salad dressing at home, I usually do it in like a mason jar so I can shake it around and really get it mixed up together. So I've whisked that. I'm just going to pour that on and let it sit for a few minutes. So toss the jicama in the dressing just to get that lovely colour and really nice flavour in this. I think you've all got some samples. How does it taste? And it's crunchy, right? So it's got a nice freshness to it. This is a really great food for nausea. And the reason why is because it's got a great taste and it's cold. So it's not as if you're opening a large dish of spaghetti and meatballs that's got cheese all over it and has that tomatoey, cheesy aroma, which for a lot of people smells fantastic, but not for all of our patients who are feeling nauseated to start with. And that smell can really make you feel more nausea than you need to. So something cold is really helpful for nausea. So I've segmented the orange, and I also put in the juice that came out of the orange because they're in season. They're really flavorful and juicy at the moment, so that's going to go in. Toss that around. And then I've got 2 lovely avocados here. So here are those healthy fats again. Great source of potassium. Often patients are low in potassium during treatment, and people always say, I know I need to eat potatoes. Well, you have other choices, and avocado is one of them. So I would really encourage that. Lovely flavors with this. So we're going to toss those together. And that is the salad. So, as I said before, healthy fats in here. We've got the olive oil and the avocado. The healthy guidelines for Americans were actually handed down earlier this year. And one of the recommendations was increase your intake of healthy fats. And this was apparently groundbreaking news. We'd been encouraging healthy fats for a very long time because they're anti-inflammatory. Plus, they make food taste good. It's the fats that give you that satiety and that mouth feel that you enjoy. And previously our message had been, you know, limit your fats because they're bad for you. And then it's like, well, what about healthy fats? What about nuts? You know, we want to be getting more of those foods into your diet. So this is a great salad, super easy to make, great for taste and great for nausea. So I hope you enjoyed it. So the next salad, which Chris is already plating, it's lovely to have such a wonderful assistant here. So uses watermelon, which is also in season at the moment. Watermelon also has great potassium, great fibre, and great fluid content. So for patients who are dehydrated, you know, especially if you're on Tarsaver and you've had some diarrhea, you want to be staying well hydrated. This is a great source of liquid. It's like 99% water. Plus, it's got a lovely feel in the mouth. It's really nice when it's really cold. It's refreshing. So I'm going to chop some of the watermelon. This salad also has feta cheese in it, which is a great protein source. So one of the questions at the previous cooking class that we just did was about sugar and cancer. Does anyone have a question about sugar and cancer? So Dr. Camage said, you know, if you're going to cut watermelon, everyone's going to be looking and thinking, she's cutting watermelon. Doesn't she know sugar feeds cancer? Sugar doesn't feed cancer. Sugar feeds every single cell in your body. It does not selectively say, hey, I've arrived, I'm going to make cancer grow. It does not do that. Sugar feeds particularly your heart and your brain, and that is its role. So sugar equals carbohydrate equals glucose. They all mean exactly the same thing. But not all sugars are created equal. This watermelon, for example, has fibre and vitamins and minerals, which we don't typically find in a brownie. So unless you're adding prunes to it, in which case you'd be adding more fibre to it, but it might not be the same experience. So what we encourage is, well, so if we talk about sugar, if we eat a carbohydrate, what tends to happen is it can cause your blood glucose to be elevated in the short term because it's an easy process for your body to break it down. And then what happens is your pancreas kicks in and produces more insulin to bring down your blood glucose level. It's a normal bodily process. It happens in everybody. If you have a carbohydrate with a source of protein or fat, that process is different. So when we have the watermelon being our carbohydrate, and then we're adding feta cheese, which is our protein, the metabolism is slower in the gut. So you don't get the big spike in your blood glucose. You get a low, more modulated blood glucose through the day. Plus, you have more energy. You know, if you eat a donut and it's your lunch, for example, within 45 minutes you're hungry and you're feeling tired. Like you've had that sugar peak and then it's gone. If you're having something that's got some protein in it, it's going to last you for the longer term. So it's going to mean that the body process is slower and that over time you're going to have more energy that's more sustained, which is why we talk a lot about having nuts and yogurt and hummus and string cheese and beans in your diet, because they're great sources of protein, and they also allow, this is giving you fiber as well, so it's a slower process in your stomach. So I really love this salad because it's got lovely fresh herbs in it. So at the moment, the mint in my garden is flourishing. I picked some this morning. Someone asked me what it was, and it's a flowering mint because it's that time of the year. So lovely and fresh. So often with taste changes, you need to add some fresh herbs to really get that sense of taste in your mouth. So this salad has the watermelon all here in the bowl. So beautifully hydrating. Red onion that has been soaked in lime juice. So you can see it's sort of gone this bright purple colour, but it gives a lovely texture and flavour to it. So we're going to add the onion with the lime juice to it. So adding a little bit of sour to the sweet to give it some balance. Then we have the feta cheese, which we're just going to toss through. And then a lovely big handful of fresh parsley. So really lovely colour in this salad. You know, part of eating is visual, so you want to make sure that it looks good. I mean, you know, it's sort of, and smells good, you know, in a fresh kind of way. So this is the fresh mint from the garden that I'm putting in here. So you can see this bowl is just looking pretty amazing at the moment. And so I'm going to toss that around. And then I've got my olives I'm going to add in. So this has got healthy fats in it as well, and the feta cheese is a low-fat choice. So if you were looking for a low-calorie recipe, this is not a high-calorie recipe, but really great protein and taste. And then we're just going to trickle on the olive oil. And this is just regular olive oil, it's not extra virgin.
Is there a difference?
There is a difference. There's a difference sometimes in taste if you're using it in dressings, but I tend to use regular olive oil because I like my olive oil to be multi-purpose. Like I want to cook with it and use it in my salads. Extra virgin olive oil has a lower smoke point, so it's not a good oil for cooking. It's more delicate, so it falls into the family of the avocado oil and the safflower, and those more delicate oils, they tend to burn at a lower temperature. So you want to use just regular olive oil, canola oil if you're cooking anything on the stove. And
coconut oil?
You can, but it's a saturated fat. So I tend to, it's a vegetable-based saturated fat, but it's still a saturated fat. So we've got some fresh ground pepper in here, and that is the watermelon salad, which I think Chris has already handed out as well. Chris, you are on fire.
Yeah.
You are great.
Let them taste it while you're...
I love it. So have you tasted the watermelon salad?
Yes.
And how is it? And was it hard?
No.
No, it was really easy. So yeah, so it's just when I'm talking to patients, the term I hear most often about food is that they're disappointed. And that is, to me, a term that brings so much resonance. It's a loss. You know, I'm disappointed food doesn't taste the way it did before. Or I'm disappointed that I don't have the energy to prepare my food anymore. I'm relying upon other people to bring me food, and I've lost that independence to do that. And food is just one of those things that is such a foundation of life. And it's so important for a social interaction, and you know, the joy that we get from eating a meal that tastes good, that if we're sitting around a table with other people, we tend to eat more and enjoy the experience more. So I really work hard, and we work hard on trying to take away that disappointment and just give some inspiration with cooking and food. So the other change with a cancer diet is we tend to focus a lot on brightly coloured fruits and vegetables, which I think is really, it's part of the general message on how to eat well. But we also have very specific recommendations that we make around processed meats. The American Institute of Cancer Research recommends that we stay away from processed meats as much as possible. And that's because they have nitrites and nitrates in them, which we believe may have some role in changing DNA. We do not know at this point in time. But so that recommendation is one that they have made for quite a long time. When you go to the store, you can buy nitrite-free meats, but we also recommend not choosing smoked meats because we do believe that there is some link between that and specific cancers. So we recommend that. The other recommendation that we have is exercise of greater than 30 minutes a day, but that is a general recommendation for the community. So healthy fats, staying away from processed meats, eating a variety of fruits and vegetables, using the American plate model where you look at your plate and 2/3 of your plate is fruits, vegetables and whole grains, and 1/3 of your plate is lean proteins. The other recommendation they have is that if you're eating red meat, to choose red meat that is lean and eating less than 18 ounces a week. So they're the recommendations, the differentials with oncology. But 18 ounces is quite a lot of red meat. The thing that I really find that we focus on is protein. Really working on protein sources that taste good, because often patients, if they're losing weight, unintentionally their albumin, their protein levels may become lower. So we really focus on trying to keep that within normal range. So where is protein, where it's located, eggs, your beans, your legumes, nuts, of course your meats, but just trying to find alternate sources for patients to enjoy and make sure that we're eating those regularly through the day. So one of the other questions was about the ketogenic diet. So the ketogenic diet, for those of you who don't know, is a diet that's actually been around for a long time and has been used in children who have seizure disorders. And it's used because the thought is that in particular seizure disorders where you've got some brain interaction, that there may be some benefit from having a higher fat diet. And what we've actually found with that particular population is a decrease in the seizure rates that those children have. So as the research in oncology and nutrition is always ongoing, there have been studies in the last 5 to 10 years on the ketogenic diet and whether it has a place in cancer. The research so far has been mostly phase 1 studies, so just looking to see, is the diet tolerable? Like, can we do this? And is there enough evidence to say that we should be doing this? At this point in time, the main body of interest is in glioblastomas and other brain types of cancers. There have been studies, if you go on clinicaltrials.gov, you'll see that there have been some studies in pancreatic cancer, some head and neck cancers, but these are very, very small patient populations and they have a large dropout rate because the diet is very difficult to tolerate. If we do a 4-to-1 ratio, it's a ratio of 4 fats to 1 protein or carbohydrate. So you can imagine it's a very high fat diet. And we don't really have enough research at this point in time to say we should all be eating a ketogenic diet. We just don't have enough to say that. So at the moment it's ongoing. There is more research being done on it. We still recommend having fruits and vegetables and whole grains and lean proteins. So if we get back to the sugar and cancer again, there is a big difference between a complex carbohydrate like the ones that you're eating today and a brownie, because you're getting fiber and you're getting vitamins and minerals, you're getting fluid, you're getting a lot more bang for your buck than you would if you were just eating a brownie. Does that answer the question? Yes. Any other questions that you have for me today? Yes.
I typically only buy fresh vegetables, but is there truly, should you avoid canned vegetables in general? I mean, it's still a vegetable, so is it, sometimes it's easier, but I generally only buy fresh vegetables, but every now and then, we're running and we're in a hurry and everybody's hungry and we have soccer and basketball and So is there truly, should you stay away from those?
So the question is, should we stay away from canned vegetables and should we always eat fresh? So here's the thing, fresh and frozen are pretty much exactly the same because frozen vegetables are picked and frozen at the peak of the season. So they're equal quality. Plus we tend not to waste as much if we're using frozen, whereas fresh things can go bad more quickly and we end up wasting more of that. Canned foods, I have a lot of patients who live in rural areas where they just don't have the choice. So, we've got to sort of think about what's available for you. Fresh vegetables may have travelled halfway around the world to get to you. So eating seasonally, I think, is really important, and trying to eat locally, like if there are markets in your area, supporting those local farms, I think that's really important. As far as fruits and vegetables go, the nutrients are going to be equivalent. In the canned foods, it's just making sure I would look for a lower sodium choice because sometimes they are higher in salt. So that would be the main recommendation. But canned beans, for example, cooking beans can be a real labour of love. I know people who do it and think it's the most wonderful thing to do. I do it sometimes, but I do use canned beans and just rinse them. So I think if you're rinsing your vegetables, I think it's fine. I think it's fine for you to do that. There was another question at the...
We need to finish this session because we have gathered people for the next session. I'm really sorry we cannot take us going on. This is really great.
So thank you all. Yes. Ask me that question.
One more, yeah.
Dairy products, what is your?
So I don't believe that there is anything bad with using dairy products. There was a fear a few years back about ovarian cancer and dairy products. There has been no evidence to support that, and that has been researched ad infinitum. What I would say is when I look at evidence, I always make sure there is no conflict of interest. So any evidence that has been funded by any large pharmaceutical company or large agricultural company is not an article that I'm interested in reading.
So Chick-fil-A